Recorder starting.
Okay.
Alright, so then recap. Originally you're here for anxiety, and it started because you took a birth control, and ever since then you just threw you off emotionally, right?
Yes, that's what it felt like.
Yeah, and then with acupuncture, every acupuncture's been good, and you've had 1, 2, 3, 4, 5, 6 5 treatments so far. Today's your number 6. And this week is your period, about to start period week.
Yes.
And you normally have this PMS, and the intensity of that anxiety PMS is much less, and your energy is still higher. Bowel movement is regular. So the brain fog is still much less. So that's all good, and you're going to work for this week, and that will be a true test. But so far, preparation of the work has been efficient. Right now, you're interested in taking Chinese herbs, and I gotta know what your body type is. Therefore, I'm going to check you physically, physiologically, and psychologically.
Okay.
Okay, so all the characteristics related to identifying your body type. So first off, I'm going to look at your torso shape. Go ahead, pull up your shirt up to your mid-ribs. Thank you. So I'm looking at your lower ribs, your abdomen shape, and I'm going to palpate your pelvic bone. Press the side and the middle. Okay. And so then pelvic bone size is more of a small to medium on the ASIS, anterior superior iliac spine. The symphysis pubis is on the small side. And I'm going to measure the width of your ASIS, that's called line 5. That's 30.6 centimeter. Line 4 is 33.0. And then pull up your shirt a little higher, thank you. Line 3 is 20.0, so that's about the same as the width of your pelvic bone, which is 30.6. Your third line lower ribs is 30.0. Okay, and then I'm going to pull this up and put your feet down. You can put everything back.
Sure.
What I'm going to do is I'm going to give you acupuncture, and the rest of it is gathering information.
Okay.
Therefore, we could just 2 at a time.
Okay.
Okay. Thank you. So the points that are good for you are LI1, GB66, GB41, small SI5, and ST36. Those are just names of the acupuncture points. You got various names. Numerical is easier to remember, and nobody had it as numerical until they got translated into English. And that's the acupuncture on the right side, and the one-sided acupuncture treatment seems to be comprehensively good. Majority of people end up just getting one-sided acupuncture.
Okay.
Because it's sufficient enough. And here you are. Any of these uncomfortable, you let me know.
No.
Okay, good. Good, you have a higher tolerance, that's a good thing. Because you don't have to feel anything to have the same efficacy, and you're experiencing that. Let's ask you some about your physiology. Okay, do you get motion sick easily, or do you not?
No, not really. No.
Okay. You could read a book in the moving car.
That no. maybe yes.
Okay. Let's give an example here. Some people. Example. Like let's say from here to Las Vegas, Highway 15. Somebody's driving. It's a straight road, right? Minimal random movement. You're on the passenger seat, somebody's driving, or you could be in the back seat. So the point is, you're looking down and you're reading something, right?
I would get sick.
Within how many minutes?
Quickly, yeah.
Yeah, within a minute or 2, right?
Yeah.
Okay, next question. Are you sensitive to caffeine?
I do drink like 1.5 cups in the morning. but that's it.
All right.
Yeah.
Yeah.
If I were to drink it in the afternoon, it would keep me up.
Yeah. So
Yeah.
that was the point of the question.
Yeah.
Then the exact is like this. Some people are so sensitive.
Mhm.
You have one serving at 12 p.m. 10 hours later, you cannot sleep.
Oh, no, not that sensitive.
Mhm.
Yeah.
Okay.
Yeah.
Other people, they could have it with dinner and fall asleep.
Yeah, I don't know about that one, but
Okay.
definitely if I had it at like lunch, it wouldn't bother me. I could
Okay.
fall asleep. Yeah.
Well, what time is your cutoff time?
I try to only drink it in the morning, anyways.
What about in the past?
I've drank it in the afternoon before. Yeah.
Yeah. So then.
And I can still sleep. It doesn't bother me too much.
Okay.
Yeah.
Definitely cannot have with dinner, but before dinner, you
Yeah.
can, okay.
Yeah, that's okay.
Before dinner is okay.
Mm-hmm.
Are you afraid of height or no?
Yes.
Yeah. So that's a quick answer.
Yes.
There's a concern, fear, and there's bodily reaction fear. Your legs go weak, your heart goes thumping.
Yeah, I would say a little bit. Yeah. I feel like I need to,
Let's say you're on the edge of a cliff.
yeah, I would definitely feel scared.
Weak,
yeah.
weakened,
and
right.
weak, yeah.
Okay. And the question, any food ingredients you don't do well with?
Yes.
What?
I recently, well, I'm allergic to watermelon. For what I've
How do you know?
Every time I eat it, I have really bad diarrhea. I feel really sick.
Not your summer thing, huh?
Yeah, so I just don't eat that. And then
Diarrhea every time. Okay.
yeah. And then the last couple of years, I try not to eat this anyways, but sometimes it's in food and you don't know it. I have a the doctor said it's more of a neurological reaction to MSG. If I eat that accidentally, I have a like a migraine with aura.
That used to be that's interesting because even allergists, I think they denied it for a long time.
Yeah.
Now how come now?
I don't know.
It's like saying celiac disease. Oh, we don't know
Right.
until we saw the intestine come back.
Right.
Yeah.
Right.
Otherwise, people are taking antipsychotic, that kind of stuff.
Right. Right. Yes, and then that only happened the last few years. I don't know, because I'm sure I've eaten it before. It's in a lot of things.
Okay, MSG causes what symptom?
It's like a migraine with aura.
Aura migraine. You
Yeah.
mentioned that. Okay.
Mhm.
All right. Okay. What else?
I think that's really it.
Okay.
In terms of stuff
Suspect with gluten.
No.
Okay. Drink a glass of milk.
Yeah. Mm-hmm.
You're okay with glass of milk?
Yeah.
Okay.
I don't really drink a lot of milk anyways,
Mm.
but if I were to have it, it wouldn't bother me.
Okay.
Mm-hmm.
All right. Shellfish?
That's fine. Yeah,
Okay.
shellfish is fine.
Any different type of melon?
No,
Honeydew, cantaloupe?
that's all fine. I can eat that. Yeah.
Okay. It's just the watermelon.
Yeah.
All right. Okay. Let's see here. Penicillin.
No, that's fine.
Okay. What about nickel containing jewelry?
Yes. I can only wear like 14 karat gold or like silver. And it's true.
It's not just the way you think, but it's the way your body is.
Yeah, it is. It's
All right,
really is.
and I confirm that with everybody else who know you. Okay.
That's funny.
All right. Yeah. Okay. Then what happens when you to put on a earring with nickel?
Yeah, I did that a long time ago, and it got infected, and it completely closed up, and so I had to get my ears like re-pierced.
Okay. Right. Infection, red rash,
Yeah.
and itchy.
Yeah.
Okay. Generally, physically it's hard to tell, but generally you're pointing towards the being the yellow type.
Okay.
Okay, because initially I thought, well, it could be the. Wow, who knows? Because no one information is 100% accurate, but as a whole, and what's standing out with me is watermelon. Watermelon. Nickel. Motion sick. Caffeine, that's kind of hard to say.
Okay.
Because you're not really leaning one or the other.
Uh-huh.
And MSG.
Uh-huh.
Okay. Now, let's do this exercise. Mint, you're okay. Before I say that, yellow type. Okay, so cool type. not a warm type. Cool,
Okay.
damp,
Okay.
not a dry type.
Okay.
So then let's just do the exercise on the damp versus, no, cool versus warm.
Okay.
Mint, is that cooling or warming?
Cooling.
Did I go over this with you before?
No, I don't
Okay.
think so.
Cucumber.
Say that again, sorry.
Cucumber.
Cooling.
Yes. Celery.
Cooling.
Yes.
Mhm.
Aloe vera juice.
Also cooling.
Yes.
Mhm.
Cinnamon.
Ooh. That'd be warm.
Yes.
Yeah.
Ginger.
Warm.
Yes. Turmeric.
Warm.
Yes.
Mhm.
You've heard that they're all good for the inflammation of the gut.
Yes.
Yeah.
Yeah.
Well, if you're problem focused, then that's what you're gonna use.
Okay.
But like medication, prescription, it works well for some people. Other people, not as well. Other people, they have to change,
Okay.
even for the same condition,
Okay.
right? So you can't really do problem focused, because
Right.
otherwise you'll throw everything in.
Right.
But what if some of them don't match with you?
Right.
If you're a cool type, what do you need? Warming or cooling?
If you're a cool type, you need warming, right?
Yeah. Because nobody's perfect.
Right.
So within range of normal, some people are warm, some people are cool, indicating opposite. It's like saying A B.
Okay.
Okay, indicating opposite.
Okay.
So then if you're leaning towards one way, you don't want to keep leaning towards that because
Right.
you'll be out of bounds and your internal physiology or molecular process
Right.
will be off.
Right.
So when everything functions within range, then you don't have a complaint. You're fine.
Okay.
So that's what acupuncture is doing to help you.
Okay.
Because you already have the infrastructure, the know-how, the automation to do that.
Right.
As with the herbal medicine, you're putting in the plant nutrients to help you.
Okay.
So it's helping you to thrive,
Okay.
not like what does this do for me or
Right.
what condition is this for.
Right.
Now, you can look it up and find all those, but first thing is, does it match me?
Right.
Okay. Then you get multiple benefits. All right. So then the watermelon, is that cooling or warming?
I'd say cooling.
Yeah.
Yeah.
No, that doesn't mean you don't match up with everything.
Right.
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 What about gluten? Is that cooling or warming?
Warming?
Cooling.
Is it cooling?
Those who have celiac disease, most of them
Okay.
are cool types.
Okay.
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 What about chicken?
Warm.
Yes.
Uh-huh.
What about egg?
Warm.
Cool.
Oh. Okay. I was like warm.
Those who have egg allergy or
Okay.
intolerance to egg,
Okay.
they're cool types.
Oh. Okay.
It's like, I'm intolerant to egg. Well, let me check you out. They come out as cool types.
Okay.
See, there's a pattern to this.
Okay.
How do you know what the cause and effect is? But there's a matchup.
Okay.
Okay, nickel, I've only seen it in the yellow types.
Okay.
Don't happen in the green, blue, or the red.
Okay.
Okay, so that one is the most giveaway.
Okay.
Although no information is 100% accurate.
Okay.
And then MSG, the cool types tends to be not good with it,
Okay.
especially the red type, cool, dry type.
Okay.
All right, so there you are. Okay, motion sick easily tend not everybody, but tend to be the damp type, which will be the yellow as opposed to the red. Although there are many reds who get motion sick easily. Okay, any food ingredients that you remember don't do well with you, or that's pretty much it?
I think that's all I can really think of that stands out. Yeah.
So then the herbal medicine, I think you could take it once a day. We don't have to rush it.
Okay.
So then once a day will last you 1 month.
Okay.
And by the end of 1 month, you should have increase in sense of well-being.
Okay.
And of course, betterment of your betterment of your mental physiology. It's why not so quick. It's because these are supportive ingredients,
Right.
and you're not taking it twice a day. Because
Right.
most people haven't taken twice a day.
Uh-huh.
But I think as long as you're consistent with it, at the end of 1 month, you could tell that these herbs are helpful to you.
Okay.
And then in the second month, you take once a day. From the third month, you take maintenance dosage, more like 3 days a week.
Okay.
Or you could take a 1 month supply twice a year,
Okay.
like in the fall time and in the springtime.
Okay.
There's the reason why I recommend either or is because you don't really right now you don't really have any issues,
Uh-huh.
and therefore let's just take enough, and then you notice that it's helpful to you, and let's see
Right.
how long it's helpful to you for.
Right.
Okay, that's one way to look at it. Or you like it so much, and you work and things can be stressful, so therefore you take it Monday, Tuesday, Wednesday,
Okay.
and you skip Thursday, Friday, Saturday, Sunday. Then when you resume on Monday, you could tell the difference.
Right.
You don't need to take it on the weekend because you're less stressed out anyway.
Right.
And you want to be more mentally performing. That's why you take it at the beginning of the week.
Got it.
Yeah.
That
So
makes sense.
that's why it becomes maintenance supported.
Okay.
Good. Let's give you additional.
Sure.
And then I'll tell you more about the herbs.
Okay.
These will be in combination,
Okay.
not one ingredient.
Okay.
Because we've been using these for so long, same ingredients, so we learned how to put these things together.
Right.
I think simple analogy is this. I had an oatmeal. Is that a meal?
Right.
It's just one ingredient, right?
Right.
So you need to have balanced diet or balanced meal, as they say. That's usually around 5 to 7 ingredients.
Mm-hmm.
And therefore it helps you on different aspects of you.
Mm-hmm.
Right? Like that, the herbal formulas are put together to help you for the different aspects of you,
Right.
to be comprehensive. What is it good for? Well, it's good for you in multiple aspects of you.
Mm-hmm.
So that will be the more appropriate answer, although we want to know exactly what it does.
Right.
Yeah.
Right.
Okay.
For your well-being. Yeah.
Yeah, well-being is a generalized outcome,
Right.
and health is also a generalized outcome.
Right.
Okay.
Awesome.
Okay, I know I said a lot there. Yeah, it's but you were following the logic,
Yes.
and I think that's fine, because you have a question later on, then we could revisit it, and so it'll help you to help it to be cemented more
Okay.
comfortably.
No,
Okay.
thank you so much. Yeah.
All right.
That's great.
I'll put the herbs together.
Awesome.
Okay.